Welcome to Hustle and Healing, the Real Talk podcast on pregnancy, postpartum, and motherhood. I'm your host, Jessica Lawser, here for the raw stories, honest laughs, and everything in between. Let's dive in. All right. So on this week's Hustle and Healing episode, we have Callie McKeown. And Callie is a mom of 2 little girls. What are our names and ages?
Adaline is 3, end of June, and Sophia will be 2, January 1st.
All right. And military spouse?
Yes.
Okay. And then previously, you were in the education system, specifically with special education?
Yes.
Okay. What kind of stuff did you do there?
So I was a paraprofessional for about 6 years, teaching 3, 4, and 5-year-olds in an early childhood education school. Those were basically just kids just coming in with speech concerns, developmental delays, possibly on the spectrum, but you don't really get like a true diagnosis until they're a little bit older.
Mm-hmm.
Now I think you can get them diagnosed pretty early, but 10 years ago I felt like it was more around like 4 or 5 years of age. So I did that at a public school, and then we got transferred to Virginia and worked at Chesapeake Bay Academy for 3 years and taught 1st and 2nd grade. And those are more kids on the spectrum, but more like ADHD, dyslexia. Everyone's on the spectrum in a sense. So it was just more of a learning curve for them. So yeah, but it's definitely my jam.
And then what transitioned you from that to?
So then I did homeschooling with Jess and Logan. And from there I was pregnant with Sophia. So, okay, let's go back. When I was pregnant with my first Adaline, I was in this at CBA, and I had a ton of complications with her and kept having to take time off. And I was high risk with her because of my blood pressure. So I was having time off. I had doctor's appointments 3 times a week. So I was like, hey, gotta miss, literacy in the morning. I'll be back at math. And it was just kind of a pain. My husband was going to deploy about 2 months after she was born. So I was like, I will take the next year off.
That sounds fair.
Yeah. So I had Adaline and had that whole year off, and Jess had reached out and, she was like, hey, do you want to homeschool Logan? And I was like, yeah, I need to do something. Get me out of the house. I'm like, if you can provide childcare for Adaline, I'm all in. She's like, yep.
So you got to bring her with you while you homeschooled.
So their nanny, Reese, who's amazing, watched Adaline while I homeschooled Logan. And then I was like, just FYI, I'm now pregnant with Sophia. And she's a double high risk. So just, prepare you for lots of doctor's appointments and things like that. Our schedule was very easy with Logan. And honestly, it was the best job I could have ever taken because it was so flexible. And Jess totally got it. I mean, she's like, yeah, she's been through the worst. So she was like, oh, just let me know what you need. And so I was like, okay, cool.
That's great to have an employer.
Oh my gosh,
be that supportive. I mean, I think
and I felt like I kind of over-explained a lot of things, like, hey, I have to do this, I have to, and she was probably like, yeah, I know, I got it, I know. But
that can make or break, like you had mentioned in the beginning.
And I felt so terrible, like at the school system. I was like, I have to take this day off. Like, is it okay? And like, I get it. Like, it's my job to be there, but in another sense, I was like, I need to take care of myself too.
Right.
So,
I mean, these weren't vacation days that you were taking.
No. I wish. So with Adaline, I ended up having to be on bed rest in May. She was supposed to be born July. She was a month early.
Okay.
And with Adaline, my placenta ruptured with her a month on the day. So she was supposed to be born July 22nd, and she was born June 22nd. And this is the crazy thing. Sophia was supposed to be born. I really just said March 1st because I think they have the date of February 29th, which was leap year. And I don't remember when leap year was. But I always just said, March 1st because it was just easier.
Yeah.
But she was born January 1st. 2 months to the day. So both my pregnancies, I swear, were so similar, yet so very different. But they were each, like Sophia was 31 weeks, 5 days. Adaline was 35, 5. My brain.
I know. No, it's hard. Like, I'm always so impressed when people can remember just like every detail and like the
My
height, the
brain
weight,
lately
the
has been so
time.
bad. Well, and I know their height and weight and I think time. But I remember asking, like friends who have kids now in their teenager years, and I'd be like, oh, what was their weight or what was their, they're like, I don't know. I'm like, how do you not know? And now I'm like, shoot, I can't remember what I did yesterday, so I can't talk.
Well, my mom knew at like my baby shower. I'm like, Mom, how do you remember like 30 something years later? Like, I mean, but those are ingrained. So there's certain things that stick out.
Well, and I think it depends too on like all the trauma stuff that maybe they have endured, or maybe the trauma helped. Maybe it's helped them remember a lot of things. So
yeah. Well, I know you have a really powerful kind of birth story with both of them. So let's kind of start with your first.
Adaline started it off.
Yeah. She kicked the party off for you.
So with Adaline, I started having really bad cramping the morning of, just kind of lower back pain. It felt like, honestly, just like a really bad period. And I told my husband, I was like, hey, babe, I'm going to call the doctor, try to get in, kind of see what's going on. Because at that point, I had been going to wherever they strap
EVMS or like.
So I did go to EVMS, but they take like those, cords and strap everything to you to check. Yeah, just to check the heart rate and everything. And you have to like pass the test and all that.
Yeah.
So I had been going to those already like 2-3 times a week.
Now, why did they want you to do that originally?
So I genetically have high blood pressure.
Okay.
So going into pregnancy, I had to switch my blood pressure meds, which I think was a lot of the cause of trying to get pregnant, because I think the original medication I was on was actually killing the baby. But we don't know for sure. So
you had miscarriages prior to?
I had 2. Mm-hmm. Okay. Yep. So then that was within 6 months. So my hormones were like insane. And then one day we were like, just not think about it, and it happened. So so with Adaline, that morning I was super crampy. I didn't feel well. I took a bath because I'm like, maybe this will help. And my husband's like, oh, I'm gonna go golf, like,
the longest
casual
sport to play.
Yeah. I'm like, leave your phone on. I'm not talking like it's on. I'm talking like volume all the way to the max. I'm gonna have to call you, so leave it on. And I did a test call, and I called him, and he didn't answer. And I'm like, leave your phone on. So I call him again. I said, hey, babe, what's going on? Just a little test call to make sure you're there. Oh, yeah, sorry. I mean, my phone's on, but it's not on. And I'm like, turn it up.
On.
So he finally turns it on. I'm driving to my doctor's appointment, and I think it was at like 11:15 or something. And of course, I'm in this construction area, and all of a sudden, I feel, and I'm like, oh my gosh, my water broke. And I look down. Oh, and let me tell you, I'm in a rental car, by the way, because 2 months prior, I had gotten rear-ended, and then my car is getting fixed now. So I'm in a rental. Mm-hmm. It was blood, a lot of blood. And I'm like, oh my God, I'm like starting to freak out. Call my husband. He answers, thank God.
Thank goodness.
Thank God he was with a medic, that he was golfing with. So his medic's like, well, you're going to the right place, just keep going there. So I'm like 2 minutes away.
Oh, good.
Thank God I'm in black leggings too, because it's summer. So I wore black leggings, I got, shirt on and everything. And I waddle myself up those stairs because I'm like, I can't wait for the elevator.
Oh, you didn't go to the ER?
No, I just went straight to the doctor because I didn't
Okay.
know what was going on.
Yeah.
First time pregnancy, I wasn't feeling any pain. I kind of felt relief.
Mm.
So I'm just holding myself, waddling up there, and I'm like, "Hi, I have an appointment, but I'm bleeding." And they're like, "Oh my gosh!" So like they help me back. The nurse gets me, lays me down, and does an examination. That examination felt like I was getting a tattoo in my vagina.
What did
I
they
was
do?
like, well, she had opened up my cervix to see what was going on because she didn't know, and there was
Ugh.
so much blood. And honestly, after having Sophia, it really wasn't that much blood, but it was still a good amount.
It
I
looks like a
mean,
lot.
yeah, it was a decent amount. So now I'm just in my shirt and nothing. And they're like, well, we can call an ambulance to take you to the ER or to the labor and delivery because you're only a centimeter dilated, but we either think you tore from whatever happened, and that's what's bleeding, or you have a ruptured placenta. And I'm like, I think I'm leaning toward the ruptured placenta, but just gonna, guess that one.
And had you known like any information about
No
like
idea.
what a
No idea. And I had been to EVMS and they said everything was fine and
mm-hmm.
everything's on track and your blood pressure is good. So I was like, okay, I have no idea. So I call my husband and, he gets there as fast as he can. And I was like, well, I don't want to go to Norfolk. I want to go to Centera Princess Anne because that's where everybody is. And being a high risk pregnancy, I've seen all the doctors already.
Yeah.
So I'm like, I want to be there so they can still see me and know me and everything. So my husband was like, all right, well, I'll just drive her there because ambulance was going to take forever and then take me to a different hospital. So he takes me there and I'm sitting on like puppy pads. I have a gown over me and just my shirt on. And he's like driving super
Oh, you like
slow, but at
walked
the
out of
same
the
time, yeah.
with the
Well,
gown on?
wheeled out.
Oh,
Yeah. But
okay.
yeah. So then he pulls up to labor and delivery and they get me out and, um, we kind of get up there and I'm getting like super nervous. But of course, my husband's like, joking around because he's like that. He's like, here we go,
Mm-hmm.
and trying to record and everything. And I have a
What
funny
a good
video of us.
husband.
He really is. He's great. So he wheels us up there and then they take me in right away. And I'm all of a sudden, they're like, all right, we got to get the baby out. Like you're bleeding internally and your placenta's ruptured. Like they just knew right away with all the blood that was coming out. And I was like, oh my God, I'm having a baby today. And thank God everything was set up at home. Diaper bag was ready for like 3 months because I knew with having high blood pressure, normally I was going to have a rough pregnancy. I knew I was most likely going to have a C-section.
Mm-hmm.
My sister had horrible pregnancies, so we're so much related when it comes to the blood pressure stuff that I just prepared for the worst.
Sure.
So I mentally and physically just like I got everything ready. And mentally I was like, I know I'm gonna have a C-section. I have no issues with it. Like obviously, you want to do vaginal, but what can you do?
Yeah.
I'm not gonna force it. So they were like, yeah, we got to do emergency C-section. We need to give you a spinal tap, all this stuff. And I'm like, oh my God. I'm like, call my mom. Like, I just want my mom.
Is she local?
No, she was in Florida. So my husband, used my phone and FaceTimed her. And I'm like, they're starting to get all these IVs in. And then, the surgeon's like, oh, here's the paperwork you need to sign. And I'm like, just sign, take her out.
Yeah.
So I'm like, whatever. So we get in there and they deliver her. And at first she wasn't breathing. So I was like, oh my gosh, I'm scared. And then she started to cry. And they brought her up next to me and she had so much hair, just dark black hair. And my husband was like, I'm so jealous because he's losing his hair. That was the first thing he noticed. Poor guy. So, but she was fine. She's 5 pounds, 2 ounces, a month early. They had her in the NICU for a day just to kind of make sure she was okay because her temperature was a little, it actually dropped a little.
And then because you were
But
how many weeks? 30.
I was 35.5
35.
with
Okay.
her. Yeah. So I ended up losing just like 2.5 liters of blood. I just needed one thing of platelets just to kind of help revive me a little bit, and then just fluids. And then I had to go on magnesium too for my blood pressure. Had preeclampsia. I actually ended up having to go back to the doctor 6 weeks later because I had preeclampsia. My blood pressure was 240 over 125.
Wow.
And I'm like, I'm going to die because the lady next to me was like in her 60s, stroking out at like 150 over 95. And I'm like, I'm going to die. I'm like,
Oh no.
that's my normal. I'm dead. Like I'm freaking out, calling Bobby. I'm like, I'm going to die. And he's at home with Adaline. And I'm like, I'm never going to know what it's like to be a parent, and
Oh.
it's real. It's real. It really sucks. And high blood pressure is no joke. I feel like it's one of the, I'm definitely biased here, but I feel like it's one of the worst things you can have because there's not a whole lot of medications you can take while either breastfeeding or being pregnant that's safe.
Yeah.
And there's not a whole lot of testing either. Like, who wants to test? There's not many people my age. I keep hitting this thing. There's not many people my age that have high blood pressure issues.
And how old are you?
So I'll be 38 this summer.
Okay.
But I started on blood pressure meds when I was 22, and it's genetic. So at that point, there was really nothing I could do other than take medicine. And when you're that young, you don't know. I was like, sure, give me whatever works.
Yeah.
And now I'm like, I don't know if I want to take that. I just know so much about it. Some people are like, are you a nurse? I'm like, no, I've just been dealing with this for a long time. So that kind of sucked. I was on a whole different regimen of blood pressure meds. I was breastfeeding at the time, so they were all deemed safe, but it's like, you really don't know. And honestly,
Did you
it was,
switch your medications at all, like when you were pregnant to after?
yeah.
Like,
Mhm.
so
Yeah, because usually you're on something called labetalol or like Precardia when you're pregnant, but not all the time. It could be different depending on kind of where you're at. But those are like the safe ones. And I was on very, very high doses of that for both pregnancies, like 3 times a day, which is quite a bit. But overall with Adaline, honestly, our
we got our little bodyguard.
my pregnancy with her was pretty good.
Gani.
But I compare that to Sophia because she was a lot.
Yeah.
Yeah. But no, Adaline was such a good baby. Thank God. I truly believe that God gave me good babies because my pregnancies were so bad. I'm a big believer in that.
So knowing, or did you know after you had her that you all wanted to have another child?
Yeah.
Or did it take some time?
Well, after I'd given birth to her, it was like 5 hours later, maybe not even. And my husband's holding her and like, I want another one. And I'm like, what? Like, I do too, but can we not talk about that right now?
Right. Isn't it crazy how they're just like, this was easy?
So easy for you. Yeah. I was like, no, not yet. Soon.
Let me stop bleeding, heal up.
I know. I did kind of want to go back to back though, because my body got so messed up from Adaline. Not messed up in a bad way, but just so different that I did CrossFit religiously before I had kids. And I just had that CrossFit body, 6-pack abs, very muscular, lean, ate well, hydrated well, didn't drink a whole lot. And then it's like once pregnancy came around, I was like, oh, I can eat this. I'll be fine. I need the weight. And after, I knew I needed to eat better, but I was just, you're in that mom mode. It's like, well, I'm breastfeeding, I need the calories. I didn't even breastfeed for that long, though. I breastfed for 3 months and then my supply just shot. And she barely, both my girls were they were so tiny, but they also like barely drank. And they got enough. I think they're just little eaters.
Yeah.
Nothing
wrong with that.
So in the beginning, with Adaline, I had so much because she didn't really eat a whole lot. And then she just started really eating a lot by like 3 months. And then that's when my supply dipped. So then I just used what I had. And from there, I was like, well, I'll have to supplement, which I was fine with. But at that point, now I'm getting in like my crunchy mom era because I'm like, all right, well, what's non-toxic, what doesn't have metals in it, what doesn't have this in it, what doesn't have that.
And that's stressful in itself.
Mm-hmm. So thankfully I found European formulas are really good.
Okay.
And got on that, and it's a whole new era when you become a parent. You think about it and you see your friends do it, but you really don't know. And they're all so different, but you just don't know. Even being a mom, let's say you had a kid, 10 years ago, and being a mom now, it's so different.
Yeah.
There's so many different things. And I mean, a good friend of mine just had her 5th baby, and her oldest is graduating 8th grade. And she's like, this is so different from when she had her first. And it really is.
Yeah, I mean,
Just
I
everything.
think you look through a different
And the
lens.
standards now, I feel, and
Well, and social media.
Yeah, social media. Like, oh, you're doing that as a parent? Well, that's not right.
Yeah.
Well,
These are the 5
whatever
things I would
works
never
for-
feed my
yeah,
kid. And you're
yeah.
like, should I just give my
Yeah,
kid that? Like, I
just
thought
give
it
them
was
all of
good.
that.
I'm like,
Yeah.
but I thought they were healthy. I
Mhm,
thought, like,
mhm.
and it's like,
Yeah,
to be able to your point, like something as silly as like give them the cupcake or give them the
yeah.
sugar. But like,
My daughter
I
had chocolate
see,
this morning for breakfast. I was like, screw it.
yeah. And it's like, but then I had to be prepared though, because
Yeah.
I know that if my son has a lot of sugar, like
Mhm.
he is like literally bouncing off
Yeah.
the walls. Like it
Yeah.
affects him.
Yep.
And so I'm like, this makes sense now. When someone else said, hey,
Mhm.
we're not doing sugar. I'm like,
Yeah.
what?
They would.
I'm like, okay, this makes sense now. So I'm like,
Yeah.
please ask me if you're going to feed my kids something.
Mhm.
So
Yep.
yeah, no, it is a different just lens that you're looking through everything, because for whatever reason we can care for our kids so much better than we can care for ourselves sometimes.
Oh, yeah. My kids eat great, and then I'm like, "Shoot, what am I gonna have for dinner?"
Yeah.
Like, I made my husband a steak last night. I try not to eat a lot of red meat, but I made him a steak, and then I made my girls, some of that steak as well, and then I got to myself, and I was like, "What protein am I having?" I think I just had noodles with I don't even remember.
It's the worst when my husband's not home
Oh,
and
yeah.
I make food and then I'm like, "Where's that French onion dip and chips?"
Yeah,
Like
I
that's
know.
a good dinner.
I've been really craving breakfast for dinner lately.
Ooh, what's your favorite breakfast? Like,
Definitely, like, eggs, French toast, syrup, all the syrup and butter and all the bad stuff.
yes.
Not the good stuff. I used to eat so bland when I was just before kids, like, I don't really salt a lot of my things because my blood pressure, but, like,
Mhm.
I was just such a boring eater. I ate the same things all the time. I meal prepped every Sunday. It'd be chicken and rice and some sort of vegetable, sweet potato or broccoli and I try to still kinda eat like that, but it's like my kids are like, "This sucks," and I'm like, "I don't blame you. It does kinda suck. Let me add some butter in there for you and some salt." And now I'm like, "All right, well, butter's good for you, that crunchy side, butter is
Yeah,
good,"
I'm
and
giving my 11-month-old like a
oh,
spoonful of butter. My in-laws are like,
yeah,
"What?"
yeah. I know, I was telling it to my parents. My mom keeps saying, "I'm old school." I'm like, "Yeah, Mom, I know." Yeah, with the vaccines and just everything. We were just getting over a cold, and my daughter had 104 fever, and it took everything in me to not give her acetaminophen because I'm like, I know her body needs to fight the fever, but
Mhm.
I'm like, dear God, if something were to happen, I could never forgive myself. And she was like just lethargic, and I could feel her heart beating in her head, and I was like, so finally it started to go down, and then I was like, all right, it's already going down. I'm giving her acetaminophen. Like, we're getting there. And
Mhm.
she was so much better the next day. But I was like, did the acetaminophen do that? Or did I let her body fight off enough of the infection with the high fever? And then
It's hard to know.
I know it really is. And I'm like, I follow like this doctor mom on Instagram, and I'm like looking up stuff. And Bobby's like, what are you doing? Just, and my husband. And I'm just like, I don't know.
I'm looking for the answers.
Chat GPT, like, what do I
Oh,
do? Blah, blah,
yeah.
blah. So it's just there's just, there needs to be a class, I feel, when you become a parent on what the hell you do. Like when we left, so after we had Sophia, and I'll get to her story, but after we had her, she was in the NICU. We had this little dummy doll, and we had to practice on the dummy doll giving her CPR. And I'm like, we didn't do this with Adaline. And I've never seen any of other of my friends like leave the hospital having to do this. This is great knowledge. Like, why not do this with everybody despite them being in the NICU?
Yeah.
I don't know
Was
if it's
this
a
at the
NICU
same
thing or
was this at the same
yeah.
hospital?
Mhm.
Hmm.
And I don't know. I mean, it was 2 years later, but it's like this should be done all the time.
Yeah.
And I know they give you like packets and packets of stuff. Like when your kid's sick, give them this medicine and Tylenol and Tylenol. I'm like, I don't like Tylenol. I don't want to give my kid Tylenol. You know?
Or I don't have time to read all of these
And
packets.
I'm not knocking people who do, but it's just like, give me something natural that I can give my kid. Like if a pamphlet were to say, bring your kid out and let him lay on the ground in the sunlight, hell yeah, I'd do that. Is that going to help my kid? Yeah. There's multiple studies that show sunlight is great at helping your body heal. I'm like, tell me that. I mean, obviously I know to do that, but my kid walks outside and she's like, it's too bright outside. I'm like, well, it's sunny out.
Here's
and
some
it's
glasses.
noon. I know. But it's like, yeah. I was laying outside when I had the stomach virus like 3 months ago. And my husband's like, what are you doing? I'm like, I'm grounding myself.
Letting the sun
And
heal
he was
me.
like, what? He just looked at me like I was nuts. I'm like, honey, just go with it, please. I'm in my crunchy era, okay?
I don't hate it though.
No.
You know, I mean, I think again, there's medicine for a reason and there's a time and a place.
Oh, and I'm not knocking modern medicine because it saved my life both times, but definitely with Sophia. My husband was like, I'm going to be a widow at 35 years old. That was what he was thinking.
Well, this build up has got me. So let's dive into her birth story.
So January 1st, let's see, December 31st, the night before New Year's Eve, you know, party. We go to a friend's house and I'm pregnant. And I told my husband, I'm like, you know, we have not even a 2-year-old yet. She was 18 months old. She 18 months? 18 and a half months old. I'm like, I don't want to be out till midnight. I don't care to watch the ball drop. I'll watch it in the morning.
Yeah, I don't
I want to
care
go to
anymore.
bed. So we go to a friend's house. Adaline has a blast. She's playing with her friends. And we come home, get her in bed. I have the TV on to maybe watch it before, but I'm like dozing. I'm tired. I'm exhausted. It's been a long day.
It's funny how you're just like, I'll see the ball drop and now close my eyes.
Yep. And, you know, we go to bed and I wake up. It's like almost 6 a.m. And I am in like excruciating pain. And I was like, is this it? Like, are these real contractions? Because I never experienced contractions before. I don't know what they feel like. And I feel like I have like the worst stomach bug or ache or something. I'm like, something is not right. It's like 7 o'clock, maybe 7:30, and I'm still rolling in bed. And my husband, he's just sound asleep, mouth wide open, breathing all the air. And I'm just like, oh, I'm in so much pain. And finally I get up. I think maybe it's around 8. And I'm like, I feel like I'm going in labor. And I've heard that before you go in labor, you have to take like a massive poop. And I'm like, I do not feel good. I need to go sit on the toilet. And I go sit. And I just feel like this relief and it's blood. And I look down and I'm like, Bobby, call 911. And I stand up, which I shouldn't have done. And it just pours out. And I just grab myself and I go to the ground and I lay on my left side. And he comes in, he's like, what's wrong? And he's like, oh shit. And I'm like, call 911 now. I have my phone with me because I was keeping track of like on the timer of when contractions were happening, like how fast or slow or whatever. And again, like I didn't even really follow any of that protocol before because I kind of just felt like I never would have to go through it because my pregnancies just, again, they sucked. And I'm like, this is too early. And so I call my neighbor right away because he's calling 911 because my daughter's sleeping. And I'm like, if we go, someone's got to take her because we don't have family around. And I call my neighbor next door. Thank God, I love him so much. And I'm like, Candace, I think I'm in labor. Come get Adaline. Like, she's still sleeping, but I need you over here. We also have carpeting in our house Thank God it wasn't on the carpet, but I was laying on a big long rug. And I'm like, "Oh god." So,
Thank goodness that you had your neighbors. Like, that's hard, that second
yeah.
pregnancy. We had to
I mean, my
plan.
husband probably would have grabbed her and had to bring her with, but it's just one more thing, you know?
Yeah.
And yeah, no, we did have
Well,
to
and if
plan,
you
and I
needed to go in the
did.
OR, like, he
Yeah.
couldn't have
I
brought
did
her.
go to their house, like, a couple months prior, and I said, like, "Hey, guys, my pregnancy is real rough this time. Can I have you as, like, emergency contacts? Are you guys gonna be free around this date?" Because I had a C-section planned. I had my, C-section date planned to go in.
Okay.
You know, I was gonna go in,
Mhm.
look all
Yeah.
nice, and have everything ready, and nope.
Psych.
No, yeah, just kidding. So, yeah, so they knew about all of that, and they were gonna take Adaline. My mom was gonna fly in, like, she already had her ticket. Everything was planned out. Like, I was like, "I'm planning this. We're gonna do this right. Everything's gonna be great." No. So, I'm laying on the floor. We have one of those bathrooms where, like, every door in our house is normal size except for our freaking bathroom. It's, like, the smaller door, like, half the size. So the gurney comes in, and they're like, "We can't fit that in there." And I'm like, "Well, yeah, I know." So they had to put me on a sheet and, like, sheet me out
Oh, no.
onto the gurney.
Because you physically couldn't get up.
No. Well, I could have, but
They didn't
probably
want.
wasn't recommended,
Yeah.
and I think more blood would have come out. So I have now lost quite a bit. I think at this point, my husband and I think I've lost, like, a liter in there. So they
In
get me.
pain or just.
Honestly, not really. No, I really wasn't in any pain. I really wasn't in any pain after that. It was like the relief coming out.
Yeah.
So they get me out. They get me in the ambulance. It's an older woman. It's another older gentleman. And then there's this young kid in there, and I'm pretty sure it's like his first day, like seeing everything. And I get rolled up in there, and he's sitting back there with me. The lady's back there with me, and I think the guy's driving. And my husband's like, "All right, like, Adeline's good. I'll see you at the hospital." I was like, "Okay, cool." I was like, "Grab my diaper bag while you're there." So he gets everything. And this guy is just, this kid. I'm gonna call him a kid because I think he's like 17 or
That's a kid.
18. Yeah. And I'm like, trying to talk to him to get my mind off everything. Got my little like puke bag, they got me wrapped up. So now I'm freezing because I'm freaking out. And I've got my phone next to me. And he's like kind of talking. I don't really remember what he was saying to me, but I think he was just trying to like have a conversation with me. But I also feel like it's very awkward for him, but at the same time it can't be awkward for him. He's an going to be an EMT, I think. I don't know.
Mhm.
Maybe he's on a joyride. I don't know. But anyway, he's getting a show today. So I'm just sitting there and I'm like, "Oh God, I'm going to get sick." Like I'm starting to feel real sick. So I'm losing blood. And I was like, "I'm going to get sick. I need a bag." And he's like, "She needs a bag back here." He's just yelling. I don't think he really knows what to do. And the lady gives me a bag and I start throwing up. And I'm like, every time I threw up, blood was just, I kid you not, just freaking squirting out. And I'm like, "Oh, I'm losing blood every time I throw up." And he's like, "She's losing more blood." Like, just
Oh,
yelling at that. And
God.
I'm like, "Oh my God."
It's like
So now I'm like
echoing.
really, yeah, now I'm like really freaking out. And so the lady's just kind of like holding my hand and she's like, it's okay. We're going to be okay. Well, they book it. Like they're hauling ass there because I'm losing lots of blood. I found this out probably a year after, but when they got me there, they lifted me from the gurney to the hospital, and as they're lifting me, my husband's like, the blood is dripping off your calves. It's dripping off of the gurney. You've lost so much." Not only that, this lady has now fainted because she saw the blood on the table.
Oh, God.
She had told me she was a paramedic
Like
for
a
like
medical
20 years.
professional
Yeah.
was.
Oh, yeah. Yeah. The paramedic.
Oh,
And I was like, "Oh, shit. You're in the wrong profession, girl." Like,
God. You might need to get a new job.
yeah. So I hope that man or boy or wherever he is now, maybe he's a great labor and delivery doctor or something, or I don't know. Maybe he's in that field, or maybe he is terrified.
Maybe he never came back.
I don't know. So I'll pray for him. But yeah, that was probably not good first time on the job kind of thing.
Look, you gotta throw them in. Like, they're gonna see some crazy
I
stuff.
know. Well, and with pregnancies you do, and there's just so much blood. It just doesn't stop.
And I'm sure pregnancies are, like, not
Oh,
uncomfortable, but,
it's
like,
just
you can't relate.
they
Like,
say
how
it's so different because you just you don't know what to do. Like they're all so different. So they wheel me up there. The things I remember are like everyone's scrambling. Like this one nurse is trying to get like, the pink strap on me and the blue just to check like the fetal heart rate and all that stuff. And I just remember them like struggling so bad to get it on. And I'm just laying there like, oh no, more blood's coming out and I'm throwing up and they're like, screw it. Like I think they got like a reading and the heart rate was 90 and they're like, we got to get her out now. So they just rushed me. They put me under. My husband signed all the paperwork. So I was just like, I was there, but like I wasn't kind of thing. And I just remember him saying like, I love you. You're going to be fine. And I wake up, baby's already out, but I don't realize that. I'm in this room. There's tons of lights. I have like 20 people in there with me. I have a nurse on top of me. I have 2 nurses on side of me. I've got someone just automatically put this thing in my hand. They're like, this is for pain. If you need it, click it. And I was like, click, 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 click. Like, I don't, you know what I mean? Like, give it all to me.
I don't want pain.
And this lady's like, all right, we're going to have to do a big push. And I'm like, oh shit, I'm giving birth right now. No, they're pushing blood out of me. There's still blood inside of me after the C-section. So they get Sophia out. My husband was there and he got to hold her. But she had acidosis, which is where when my stomach fills up with blood, she was breathing in that blood from the rupture. And because of that, they thought she was brain dead when she was born. So my husband's like, crap, like my daughter's brain dead, my wife's dying. He's just running back and forth. NICU to this, the wherever I was in, whatever room I was in, labor and delivery. And this poor man was just running back and forth and
So they
kind
told
of,
you, like, shortly after you delivered that they thought that she was brain dead?
I didn't know any of this. This is what they were telling my husband.
Okay.
They're working on me in the room, and they're trying to get my body to clot. Because what happened was when my placenta ruptured, with Adaline, it ruptured, but the blood was kind of trickling out because it didn't come out so fast. And when the blood comes out fast, your body doesn't have enough time to coagulate, I think is the correct term. So the blood doesn't have enough time to clot. So it just keeps coming. And there's like, your body's like, oh, no time to clot. Like, just, it's all coming out. So with Adaline, it clotted. With Sophia, it did not. So I kept losing and losing blood. And my husband was like, you were like white as like that chair, white as a ghost. Like he has seen some corpse, I'm sure, but like blue lips, white, no blood color at all. And I just remember laying there and the nurses are on me and they're pushing out. I'm like, don't hurt my baby. And they're like, sweetheart, your baby's out. Like she's born. And I was like, oh my God, is she okay? And they're like, we don't know a whole lot, but I think she's going to be okay. And I was like, okay. And then Bobby had come in and I was like, is Sophia okay? And he was like, I got to hold her. She's really little. And I think he was just trying to, because he didn't know anything yet. So I think he was just trying to avoid saying like they're scanning her brain right now to make sure she's
Yeah.
okay. So I was like, okay, good, and by then the medicine hit me and now I'm cracking jokes with the nurses while they're on top of me and they're all cracking up and they're loving it. And they're like, this is the best patient we've ever had. And I'm like, this is great. Like just click, 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 get all the
High as a
blood out. Oh yeah. Oh yeah. I was like good to go. And again, it's still like so fuzzy, but I just remember them pushing all the blood out, hooking up blood. Apparently, they had ran out of blood. So a nurse was on the phone just hounding, trying to find where they could get blood. I think they got some from like Norfolk General. I'm AB
Scary.
negative, so it's not a very common blood type. So it was just intense. At that point, it had been 6 hours, 6.5 hours since my blood had clotted, and it was starting to clot. They were giving me products. They were giving me everything they could to get to clot. But at one point, my husband said, like, the surgeon walked out and was like, I don't know what to do.
What?
And yeah, and my husband was like, well, what do you mean you don't know what to do? And he was like, we're running out of options. And my husband then called his uncle, who is a top surgeon in Baltimore, and was like, I need your help. And he was about to fly his team down to take care of me, to figure out what was going on. And thank God something happened in an hour. God's freaking miracle. And they came out and were like blood clotted. And my husband's like, thank God. Like he dropped and he was like, oh, thank God. And at that same time, they came and said, Sophia does not have brain damage. So God was looking out so hard.
Your husband was probably like,
He
breathe.
was running back and forth. And he remember him telling me this, that he was like, the surgeons were like, hey. And he was like, me? And they were like, everything's good. And he was like, you're talking to me? Like he didn't know. He was just like, everything had been falling apart. And he's like, oh my God. So yeah, almost 8 hours later, my blood clotted and I lost 4.5 liters of blood. I had over 13 transfusions.
Wow.
So I was brought to the ICU, which I was supposed to be there for a week. I was there for 24 hours. And I was a mess. I mean, I had bags load. I mean, you see like, people in horrible accidents, like that was bag everywhere and tubes and everything. And the surgeon who came in, who took out Sophia, said, we need to do another surgery tomorrow. And I was like, what? My husband's like, for what? I had a, now I can't think of the name. When your blood clots, it forms like, I can't think of it, but I had to have it removed.
Okay.
And they also wanted to go in and make sure that there was no internal bleeding still. They said if I had internal bleeding, a hematoma. I had a hematoma. So they had to remove a hematoma. They also said if I still had internal bleeding, I would have to have a hysterectomy. I was like, fuck. I was like, you know what? After this, I'm not having any more kids anyway, so just take it all out. But they said if you have a hysterectomy, your recovery time is going to be a long time because of everything.
Mm-hmm.
So at this point, I go in for, the next day, I'm super nervous. I was like, please give me that thing so I could just click away. And they start laughing. They're like, we'll give you a cocktail. I was like, okay, thank God. But I mean, there were nursing students that came in because I was a very rare case and they needed to learn. And the doctor was like, do you care are you okay giving permission for nursing students to come in? I was like, yeah. And I was just laying there. I looked like a giant elephant. My feet were so swollen, I couldn't even wiggle my toes.
God,
My hands were like this. They were so swollen, I couldn't even move them. My face,
you're just like
I
in
had like a
pain.
triple chin. I was pretty well taken care of with the pain, but yes, I was just a big mess. And I hadn't seen my daughter yet. And I was like, I want to see my kid.
How long had this been? So now
24 hours. And I still had to have the surgery. So I had the surgery the next day. And after that surgery, it was like 2 hours. And they did a special thing where they couldn't have taken her out of the NICU, but they took everything with her. Brought like her oxygen, everything, and I could hold her.
Oh.
I was like, thank you. And at that point, I think it had been like 36 hours since I hadn't seen her, held her. And I got to hold her and it was amazing. And I was still kind of drugged up from like the surgery and everything. I mean, I was a mess.
And surgery went fine?
Surgery went good. They removed it. There was no internal bleeding. Didn't have to do the hysterectomy. So that was another praise from God. So everything was just looking up from there. This was now day 2 and I got to hold her and my husband had been informing everybody, but let me tell you that night after I had held her from having that second surgery, I thought I was going to bust open my stitches because I was so sick. I was throwing up constantly. I couldn't even sit up to puke. I just laid there and I was like, like I couldn't move. And I felt so bad, and the nurses there were so amazing. Oh my gosh, I'm still like, I ended up going out to lunch with a nurse who they were all so great, but she was just extra for me, and I was like,
Mhm.
"I'm so sorry, I smell so bad, and I puked all over myself." She's like, "Don't worry, like, it's my job, and I get it," but
I
me, I
know.
was just like, "Oh my god," and I just sat there and just threw up on myself, like,
To see
I couldn't
someone
move, I had no I couldn't do anything. I mean, I didn't walk for a week after that, and I couldn't I had n my core was just shredded, just torn, and,
well, to have someone
that
care for
was
you in,
oh,
like, your
yeah,
most vulnerable
and I just felt so
state.
helpless, and I just felt so bad every time my husband came, I'm like, "Can you give me this? Wait, can you give me that? Wait, like, I need this," and I couldn't eat. I lost 25 pounds when I went home. I didn't even look like I had a kid.
Mm.
I mean, great way to lose weight, not really, but yeah, at the same time. I
Jeez.
was pre-pregnancy weight when I came home, but I was in the hospital for 2 weeks, and, my parents came to visit, thank God, and let's see, the 3rd day, I had a kidney specialist, a nephrology came in, and they were like, "We need to talk about dialysis," and I'm like, "Dialysis?" I'm like,
What?
That's for, like, old people, right?" I was like, "What?" And they're like, "Well, your kidneys are they're failing." And I was like, "Huh?" I was like, "What? I just had a what?" All the blood I lost. My kidneys were failing. They weren't functioning
Filtering
and
and
filtering everything. And I was like, "Oh my god." I was like, Do I need new kidneys? Like, what do I do?" And it was, like, just completely on the table of having that done, and I was like, "Oh my god." I called my mom right away, and my dad was with my mom too, and he was I think that's when my dad at one point was like, "Oh, this was, like, for real." Because you know how when you share this or you say, like, "Oh, she lost this amount of blood," or whatever, people don't think about what else happens when
yeah.
you lose all that blood.
Mhm.
So I'm like, "Oh my god." And then my liver enzymes were super, super elevated. So that was a potential going into failure. So I was like, "Oh my gosh, I just had all this happen and now my body's failing. Like everything's going into failure."
Mhm.
And I was so engorged too. Like I was like, "Well, I can't breastfeed. I don't have anything to give." I was started on blood clotting medicine. I had had all those transfusions. Um, I was now getting treatment for my kidneys, getting whatever medicine they had given me for that. I was on antibiotics for any infections. My blood pressure, I mean, I had a cardiologist in there just talking about my blood pressure, what medicine I would be on. I was like, I'm opting out of breastfeeding because there's no way.
Yeah.
And thank God I was able to use the NICU breast milk
Like the
bank.
donations. Mm.
Yes. Prayers to those moms because man, that helps so much. But
Is baby still in NICU while
baby's
you're
still in the NICU. She was on oxygen for 24 hours and then was off. She looked like a little scuba diver. It was so cute. She was so tiny. She was born at 3 pounds, 12 ounces, 17 inches long. Um, and she was thriving in there. She did
Yeah, long
great.
baby.
Yeah, I know.
Mhm.
Pretty long. She was doing great. She got off oxygen and she had a feeding tube and all of her stats just started going up. She had no issues in there other than like she was just small and that was it. She had a little what is it, the bilirubin stuff,
Mhm.
but
Jaundice.
yeah, jaundice. And she had a couple light therapies, but she was great. So
But you were
I
allowed to
was
at least
dying and she was doing fabulous. So that's where we were. But yes, it was a huge relief. Um,
So the surgery, did they want you to go in and do anything for the kidney stuff, or they just put you on
no,
medication?
they just put me on, I think they were giving me supplements and trying to see how they could help get it better. I started getting a really bad headache. And I was like, I would feel much better if I just got an MRI or an MRA or whatever to see what was going on. Well, it's called like a vasoconstrictive vessel, something that had happened in my head, which is very common to extreme blood loss and birth.
Mm.
So I had that, and now I'm put on stroke watch. So I'm like, great. So I had all those freaking
One
things up in the
more
bed. So that's what now? 3 things: possible liver failure, kidney failure,
stroke.
the blood vessel in my brain gets better.
Whew.
I now have COVID. So I have neurology in there with me talking about my head, asking me all these questions. And she's like, oh, well, I kind of think it's related to COVID. And I'm like, well, no, because the MRA thing came back and said it's not. So I now have COVID, and I'm starting to like sit up and being able to move around and potentially walk soon. And I can't go anywhere because I have fucking COVID.
Oh my God.
So
So
they
now
moved
they
me.
kept you there, or like?
So they moved me. I was on labor delivery. I went to mother baby.
Oh, because you
And
probably couldn't see your.
yeah, I couldn't see her yet, but I was in mother baby. And when I had developed COVID, they swabbed me, but my blood pressure spiked. So they're like, well, we need to move you back to labor delivery because our nurses can't handle that in mother baby.
Oh,
And I'm like, what? So we go to labor delivery. They pump me with a bunch of meds, get my blood pressure back down, go to mother baby side. And I get this corner room all the way at the end of the hospital by myself. And I'm like, son of a bitch. I can't even go see my kid.
you were just
Yeah.
so
So I couldn't see her. I could
contaminated.
not see her the rest of the time. My husband, he did not get it, but he was like, I'm not risking bringing it to her. So thankfully, we were able to see her via Zoom. They were able to put a camera on her and we could watch her via Zoom. And then in another week after being there, we went home and I could watch her on the TV. We put her up on the TV and could watch her for a couple hours, but I couldn't see her for 2 weeks.
Wow.
Mm-hmm.
Ugh.
So that was miserable. So I developed a very close relationship with the nurses there and could call them and see her, and I got pictures, and it was really great. But I was still on the fence of like failure for everything, pretty much. So before I left the hospital, I was now getting like these blood clotting shots, and they are so painful. And they were giving me supplements like calcium for my liver, and I went home with a plethora of medicine, 12 medications, I think it was. 4 of them were blood pressure, and one of the blood pressure meds I had to take every 6 hours. I had timers on my phone, like,
I was
I
gonna
was
say,
in
how do you keep
trouble.
track of all of this?
It was so much. So, like 2 days before I went home, nephrology came in, which is the kidney specialist, and they were like, "Hey, your numbers are starting to go up. We're gonna potentially take the dialysis off the table. Just wanted to let you know." And by the time I had left, dialysis was completely off the table. So I was like, oh, thank God. But till this day, I got checked in January and I still have protein in my kidneys and my liver enzymes are still elevated. So I'm still healing internally from all that blood loss. But yeah, 4.5 liters of blood and a baby.
That is so.
2 surgeries later, they had said it was one of the worst cases they'd ever seen there. And I was like, I pray you never have to go through that again. And on top of that, they had a full staff. They let go of like half their staff because it was so dead. And then I came in
Oh,
and they're like, oh shit.
we shouldn't have done that.
Yeah, we should have kept them. So
I
the
mean,
on-call surgeon was on her way. They were like prepping me for the table and she wasn't even there yet. And I mean, I didn't know any of this. I just heard
yeah.
about this later, but I was like, holy shit. So God was definitely looking out, but man. So if you ask me if we're having any more babies, that would be a hard no.
I wouldn't
But
need
our
to ask
babies are very
any.
healthy. And thank God I recovered pretty quick, I would say. I mean, again, I'm still recovering, but the
Mhm.
fact that I walked out of that hospital 2 weeks later is a big miracle because they had projected me to be there just as long as Sophia was there.
Mhm.
So,
That's so
yeah.
difficult. I
Mhm.
mean,
So the aftermath of all that, I mean, like, gosh, I started back at the gym in July and I was only recommended to work out once a week. And that was lightweight. I remember back squatting and 155 pounds felt like a freaking boulder on me, like, just so heavy. And I was like, "I am so weak." My legs were just so skinny and weak and just
How many months
frail.
after was this?
7 months
Okay.
postpartum. Yep, and some of my friends would be like, "Oh, ran a mile after having my kid, like, 3 weeks ago," and I'm like,
But you can't
I know.
you can't
I hate comparing
compare,
myself to other people, and I think this is
but it's easy to
really
do.
it is. And it's like, you see all these moms that even just these, I wanna say young women who just have these natural births. I mean, I just watched a video the other day. This lady's like, "Oh, my baby's coming." And she just pulled it out in the car on the way to the hospital. I'm like, I told my husband, I'm like, I'm dead. Like, baby's out, but I'm dead sitting in the chair right there. Like, no way. No
Yeah,
way. No way. So again, I love modern medicine. I think it's great
yeah.
for the things that are emergency situations like that. When I need to be pumped with all that medicine, absolutely save my life.
Mhm.
But when it's like your child has a fever and give them medicine right away, it's like, no, let their bodies. Your body is so good to you, and there's so many things it can do for you, and let it heal. Let your
Yeah.
body heal naturally, and then resort to the things that you need to resort. And people are just so quick because it's so easy.
Mhm.
Grab the bottle, 5 milliliters, bam, done. And now I'm like, I mean, I even refused so many pain meds when I was in the mother baby side because I was like, I don't want to be resorting to pain meds. I barely took them, but they were like, you need to because your blood pressure is super high, meaning you're in a lot of pain.
Right.
And I was like, all right, like, I get it, but
So when you got home, it sounds like kind of physically 7 months is where you started saying like, "Hey, like, I wanna start getting back into things."
so I was on stroke watch for 6 months. So I couldn't really do a whole lot until that
Mhm.
stroke watch had kind of lifted. And then from there, I was like, I need to start moving my body.
Mhm. Were
So,
you also dealing with, like, I mean, the mental stuff
oh
from
yeah.
just, I mean,
I had started
processing.
back at, work, 'cause I was working for Jess still. I was teaching Logan. So think I came back in April and just worked those 2 months, April to May, and then we were done.
Mhm.
And that was a huge just, like, that helped so much because 'cause I'm like, I need to get some sort of steady routine, and I could bring Sophia with me, and, their nanny was still watching Adaline, so it was really great, but it was still a lot. I mean, I was exhausted all the time. I napped probably twice a day because I
Mhm.
just had no energy. My levels were just so up and down off the charts, and I was getting labs done every 3 weeks just to see where everything was at. But I was still taking those blood pressure meds every 6 hours. I was on 4, the highest doses, I swear, like, each one. And now I just had a physical with my primary doctor. I'm on 1 medication. One of the lowest
That's
too.
amazing.
So I'm pretty proud of myself. I've come very far. But
Yeah.
it is hard because you you have such we are our own worst critics. You have such high expectations. And I knew going in, I didn't really have a birth plan. I had my own plan. I knew I was going to have a C-section. I knew it was going to be rough. I was
Mhm.
mentally prepared for that, but I was not mentally prepared for all of that.
Yeah. How
I
could
think the worst
anyone?
I think the worst was I was not mentally prepared for the aftermath of all that.
Mhm.
Because, like, then them coming in and saying, your body's failing," and I was like, "What?" Like, I just went through all of this and now it's failing.
Yeah.
But, giving it time and letting it heal, that is the strongest part a mother can do is giving yourself time, in my opinion, and healing you for you. Like, I remember thinking, like, I really want to breastfeed and it would be so great for Sophia. She's 2 months premature. That milk would be so good for her. But I'm like, I can't do that for her if I don't heal. And if I don't heal, she can't heal. So I had to take a big step back and just be like, I need to do this for myself. And part of me kind of still to this day, I have a little resentment against myself because I feel like I kind of neglected her at times. especially being that second kid, because you're a little more like, "Yeah, they'll be fine." You know what I mean? Like, when they
Mhm.
cry, like, they'll be good."
Yeah.
But I still feel that mom guilt of like, "Well, I could have gotten up and done this." Then thank God my husband was home. He had the full 3 months off. We had some extra time, you know, the Navy really treated him well when it came to that, and they understood, and he was updating them, and
Mhm.
but it was a lot on him too. I mean, he saw everything,
Yeah.
and that was another thing that I had to take in was, like, he I went through a lot of things, and I went through a lot of things by myself, like, when he wasn't there, but he saw it all happen, and if I were to see my husband go through that, that would give me nightmares.
Yeah.
So,
Are there things that you're doing or that you both are doing together that, like, have been a part of, like, your healing journey?
um, I'm in trauma therapy right now, and I feel like that's helped. I was seeing her every, like, 6 weeks, and now it's extended now that I'm doing better. But, that's another thing too is I was on anxiety meds for a long time since I was 26, so almost 12 years, and I just got off them starting in January.
Wow,
Mhm.
that's
So
amazing.
that has been a process because I get very irritable with a lot of things now, but I've found, like, so many like, working out helps a ton.
Mhm.
Um, those recess mag drinks from Target, if you haven't had them, I recommend them. They're really, really good. They're magnesium drinks.
I don't think I have.
Um
Or actually, are they the ones that are, like, the color like, you said it's called Recess?
mhm. They have, like, cool color cans.
Yeah, yeah,
Yeah.
yeah. Okay, I've seen them, but I haven't.
Those have really helped me a lot. The Tandy gummies, they have, like what are they? Mellow Melon is one of them. Super I just eat, like, the whole bag, and they just kinda help you calm down. It's recommended you eat the whole bag, but when I first tried them, I was like, "Do I have 1 or, like, all of them?"
Right. Are we talking about, like, an edible? You
Yeah.
bite into one, you don't
It's not
know?
like an edible like that, but they have, like, L-theanine, which is, like, a magnesium that helps kinda calm you.
Yeah.
So,
I was drinking
those
some, like, the I don't know if you've had, like, the Hi-O non-alcoholic drinks, but they have, like, that in it and, um,
I don't
like, 'cause
think so, but, yeah, any of, like, just the nootropic stuff or,
Yep.
like, Adaptant, yeah, those have been really, really helpful for me. I don't drink anymore. I haven't drinking since I got pregnant with Sophia, so that's also been really, really helpful with my anxiety because I remember, like, the next day being hungover or even just a little bit, just having that little
Mhm.
effect would just make my anxiety skyrocket, and so therapy for me has helped a little bit, but I kinda do my own therapy now. I've always been, like I wouldn't say not a rule follower, but I've always enjoyed doing things myself. I don't like to follow, like, verbatim, like, book like the book says do
Yeah,
this. I'm like,
textbook too.
I kinda just like to do my own thing because I like everyone's so different.
Mhm.
I'm, like, trying to deal with potty training with my kid right now, and there's so many books and things,
Oof.
and I'm like, "Well, this might work or this might work," or, "You know what? I'm just gonna try and see what works myself."
Mhm.
Um, so my husband, we kind of do, like, our own therapy sessions where we'll sit and kinda make sure everyone do, like, a check-in, make sure we're
Yeah.
all doing well, but honestly, we talk about what happened, and every time we talk, I find something new that he hasn't told me,
Mhm.
and, it just helps. It helps to talk about it. My mom was like, "Do you think you'll get emotional today when you talk about it?" I'm like, "No, because I've talked about it so much that it's actually helped me." It's not really trauma for me anymore. It's just there, like, it happened, and I'm
Your story.
healing from it. Yeah, and I'm learning a lot from it, and it's taught me a lot. And I do have a lot of friends who look up to me and will ask me, like, "What should I do with this?" or "How should I go about the doctor when this happens?" And I'm like, "Do what your body feels." And, that's really the only thing you can do. Just tell them exactly how you feel. And if you feel like something doesn't feel right, go in. Don't even
Yeah,
question it.
right.
Just go
You're
in.
never gonna regret
Yeah.
going and
Even
get
if you
checked.
don't have an appointment, go in, because if something happens there, you're in the right place. So
Wow, Callie. I mean, I know we got to talk for like 15
yeah,
minutes and I got a little snapshot, but
that is it. It was a wild, wild story, wild ride.
I know.
But
But you're doing so
Sophia's doing so well. But I will tell you, it doesn't end there. Sophia had something super rare. She had an ovarian torsion when she was 8 months old. And that is where her ovary twisted. Her ovary flipped, her fallopian tubes twisted. Of course, my husband was on a trip, so he wasn't there, which is every time anything
right. The
happens with the girls,
timing.
he's gone. I'm like, oh, God. So he has to fly back. I'm, headed to the hospital, and the surgeons, multiple surgeons come in and they're like, well, we need to do surgery on your daughter now. And I was like, huh? Like, for what? What is this? What's going on?
Why does it always seem like such a
Yeah,
shock? Like, you know what I
it
mean? Like they just
is.
come in and it's like,
Yeah. Yeah,
no prep,
surgery.
no.
Let's do it. And I
God.
was like, oh, calling my husband, like, they're going to do surgery. Obviously, he can't be there right then and there. And I think my neighbors had my daughter, or a friend had my daughter. And I'm like, thank God for community, because,
Mm-hmm.
oof. But yeah, so what ended up happening is they did the ultrasound. On the ultrasound, they saw her ovaries were twisted and flipped. They were going to do the laparoscopic surgery, so it was less invasive, especially with her being so little. So recovery time was pretty quick. They still had to put her under. And man, when they took that little baby back, I was like, oh, it was so sad. But I ended up just calling my husband, calling my mom, calling some other friends, and by the time I was
Just
done,
stay busy.
yeah, and
Just
by the time I was done, I got up to go to the bathroom and the surgeon's coming out, and it's like had been 45 minutes, and she's like, we're done. We actually went in there, everything looked clear. The ovary is super swollen, but it actually unflipped itself, so we didn't have to do anything. And I'm like, seriously? And she was like, yeah, but it could happen again. So now that you know what the symptoms are, which
what were
she was
yeah.
like super lethargic one morning, wasn't eating, wasn't drinking, just kept crying randomly. And she's not a crier. Like, she just was a super chill baby. And I was like, what is wrong with you? Like, I thought maybe she was constipated, So I
Mm-hmm.
started doing like muscle stuff and, the bicycles, and no, and I brought her in, and yeah, so that
Just
was
in the
that. And then she had just recently severe vomiting. And I was like, oh, please, God, don't let this be like the torsion coming back. And we had brought her in and got her tested again. And thank God it was not. But let me tell you, holding down a little baby to put an IV in is the most heartbreaking thing.
mm-hmm.
And I was dripping in sweat from just holding her and calming her. And these poor nurses, like, I felt so bad for them. I'm like, please, I mean,
I don't want that
just
job.
do your thing. But they were like, they even got to squeeze the arm. And I was like,
Mm-hmm.
how do you even find a vein in this little arm? Is like this big.
Yeah. I don't know. Yeah. So we had to take my son in at 3 weeks because he slipped out of his car seat and hit our front porch. So every time I feel like I just need a new house because every time I like walk through, I'm like, there's the time I dropped my kid.
Oh,
And so 3 weeks IV. And I remember being like, how do you get an IV
yeah.
in this little baby? And he's just, you're like, and you're trying to calm a baby, but how do you calm him down
No, you can't.
when
I was
they're in
like
that?
shoving the passy in her mouth. I was like, it's okay. And she's like, "Ah!" And I was like, just take it. Like, I didn't know what to do. I was like, what do
I
I do?
know.
It was so sad. So she has definitely been my stress girl for sure. Like, just always worrying about her, because she's still immune compromised just from being so little. And she's just gotten sick a little more than Adaline had ever been sick. And
Mm-hmm.
now I tell my husband she's a boy we never had, because she still looks like a little boy. She barely has hair, but like, she's just all over the place. She's like trying to run now. And she's been in therapy because she has right-sided weakness. So her left side's stronger. So she favors
Mm-hmm.
her left side. So now that she's walking, she kind of has like this little like pirate walk. She's got the little waddle. So she's been in therapy for that. So she is just throwing us for a loop all over the place, but she's healthy, she's happy, and
That's
So
all
I
you can
can,
hope. You're
yeah,
just, you know.
I'm so thankful for that. And I'm on the mend. I'm doing good. I actually have a competition tomorrow, which we have been
Yay.
sick the last 2 weeks with this upper respiratory
Yeah.
thing. So I'm feeling so much better, thank God. But
And
it
once you get the
started with
move in,
Sophia, then Adaline, then me. Of course, my husband never gets sick. I swear in the military, they like pump you with everything. So you don't get sick.
mm-hmm.
So
Well, Callie, I'm like just hearing your story, like, and where you were and what you've been through and where you are now. Like, I'm proud of
yes,
you
thank
for,
you. It's been
working
a
on
ride.
yourself and your competition tomorrow. I can't wait to
Yeah,
hear. Let me know how it goes.
thank you.
Um, I think that's about our time now. But
Yeah.
I feel like we could talk for, I'm
I
like,
know.
we could talk for hours and
Just keep
hours.
adding it.
But until next time, keep hustling, keep
Yeah.
healing, and thank you for coming
Thank
on.
you.
All right. Oh, thank you. Man,
Yeah.
girl. Whew.
No.
Come hang out with me on Instagram at Hustle and Healing Podcast for more real talk, laughs, and support. You can also catch the podcast on Apple Podcasts, Spotify, and YouTube. So be sure to subscribe, follow, and leave a review if you're loving what you hear. And do me a favor, share this episode with a fellow mom who needs to hear it. Keep hustling, keep healing, and don't forget to reheat that coffee. Again, see you next time.